mental health. So I'm so happy to express the mental health issue as well as its prevention in today's program.
Thank you for inviting us here, and we are very delighted that everyone is so concerned about mental health these days. And talking about the mental health gap, as we have mentioned, there was a research done recently in 2023 which shows that in OPD cases, it was done only in OPD patients who have come to psychiatry OPD itself, and it shows that 54%. It's so sad to know that 54% of them said that they had lack of knowledge, or either way, there was a huge gap between the mental health treatment. So it's very sad to know, even in this 20th century, when there is a huge gap in treatment. So it is our responsibility to move forward and take care of ourselves and reduce this treatment gap.
Since the foundation for the mental health is begins with the mental education and awareness itself. So can you share about some of the socio-demographic factors about the illness?
Since common illness, most of the people think that mental illness is like a man. That is very, we are very fed of that. If people or anybody go to psychiatrists, they feel that, what happened? They feel the negative impact that you have suffered from major psychiatric illness or major mental illness. That is not only that. Stress is one of also the mental turbulence. So we focus, if to relieve the stress, coping skill, we have to focus like this is one of the Lumbini Toastmasters is also one of the coping skills towards the sharing your family life, your business and your job. So that we think that we have to share our feelings, and if there is problem, then we also need some lines. So we have to think that not only the psychosis or severe mental illnesses as a mental disease, we have to think that anxiety, depression, post-traumatic stress disorder, adjustment disorder, and different panic attack is also a mental problem. So we have to address that also.
As you have mentioned, the social demographic profile. Any patient, any person with mental illness, 10% of them, overall 10% of them can have mental illnesses anytime in life. And current mental illnesses, people experiencing current mental illnesses are 4% at present in recent study. And anyways, children also, they have suffered out of in a children age group. 10 to 13% of them suffer from any kind of mental illnesses. So it is an area of concern for us, for everyone, to keep ourselves updated and let our children know that anyone can suffer from mental illnesses, and how do we avoid such situation or take care of ourselves for future. And talking about the age group, there are we have illnesses which arise in the certain age group, like female are more prone to depression, anxieties, and male are more prone to bipolar disorders. However, it is shown that equal prevalence is there, but male are more prone to mania. So, psychosis, there is equal prevalence. So there are different illnesses which have different for different age groups and gender also.
Same, Dr. Arpana, mental illness from adult. It is very important that turn from if angerness, if children are not able to go to, feel deny of going to school, and they feel that they are not eating their food, and they are always irritable towards parents, then we have to think that there is some problem, and mental problem is there to outside. So we have to focus that there is different symptoms as compared to adult towards the children.
Yes, it seems that no one is immune to mental illnesses, including the children. Hence, I think we need one more session on the awareness regarding the children. But today we will focus especially for the adults, that too mental stress or illness at work due to the occupational hazard. So let's start defining who is mentally ill, or what is mental ill, or who are mentally ill.
WHO also has defined that we should be physically and mentally well-being. That is WHO has also defined. If patient is healthy or if person is healthy, it should be physically as well mentally well-being. So we should not neglect the mental health. However, mental health defined as how we can cope with the different situation. We adapt with our emotion, thought, and we change into the behavior. That is also a mental health. In this situation, if there is miscommunication between our feelings, thoughts, and our behavior, then it leads to the mental disorder.
Dr. Arpana, can you share about when to seek help, especially the professional help?
Yes, that's a very good question because no one knows when to seek for help because everyone denies it. This is the known fact. Everyone denies that they are not mentally healthy. Even us, talking about doctors ourselves, we are so denial that we want to seek for help. And whenever people go to psychiatrists, go to any mental health professionals, we usually deny it. Then talking about the layman, definitely everyone will have the stigma because of this is all because of the stigma. And the main points we have to note is that when a person is not able to function socially, occupationally, and also personal, when there is disturbance in the social biological rhythms like sleep, appetite, and when they start isolating themselves and they don't go to work at all, or they get very violent sometimes, and they refuse to eat even for days. There are patients who refuse to eat and they have not eaten since 7 days or let's say a month. So that is the time when and when the person is suicidal. That is very important. And there are a few other points, but these are the highlighting points when we have to know that we should seek for help despite of any thing or any taboo or anything. Would you like to ask?
Of course, basic things is that if there is tolerance or there is disturbance in sleep, appetite, and change in behavior, then we have to think that we have to get help.
So disturbance in sleep, change in appetite, then we must seek help immediately. Who have attempted suicide or those who have attempted suicide.
Yeah. There is some random signs that the suicidal person think that we have to focus to our community, to our family. They are given a chance that they already given a chance that we have to rescue them. Like, number one is if they are isolated, that if they are thinking they are going to job, they isolate from the job, they are not going to job, they are isolated from their family, or if they are abusing drug or substance as well as alcohol regularly, then we have to think that that is the alarming signs of prevalence, that is the alarming of suicide. And by talking also we can know that those people will talk maximum negative feelings and they describe themselves as negative thoughts to the other people as well as family. Then we have to think that we have to open up and we have to share our feelings that this is not your result, this is not your rescue for your life. So if our family member or community or friend who not able to prevent that situation, then we have to go to expertise for that.
Which means we need to talk to them.
Yes, on this. As you have said, should we talk to a person who is suicidal or not, who have previously attempted a suicide? We usually get patients who talk about suicide to us, and they are so thankful towards us because they know that we know about them. We are the person who will ask about suicide because we are not judgmental about it. Because people usually say a person who commits a suicide is usually a coward. So they are not a coward, but they are sometimes they feel so hopeless that nothing is left for them in this world. So they want us to ask them. We should know that when to ask for it, but we definitely have to ask a person about suicide in every case, especially in cases of depression, And if we know that a person has committed suicide previously also, then that is a must.
Great. So it shows that we, even as a person, not just a medical person, we have to stop being judgmental and maybe start taking the lead by leading the discussion. Now, since we here are mostly working or either employee or employed, we will all be facing stress at work. Similarly, no one is immune to work stress at work as well. So I would like to discuss about the burnout. Initially, burnout was also kind of considered to be into a classification disease, but somehow it has been defined a phenomenon, not a disease yet. So would you like to highlight about it?
Can you discuss with openly with our panel?
Yes, indeed.
Yes. First of all, what our members are thinking about the stress. It is good for our life or not?
Can we know some of the response, whether stress is good or not?
I would like to say something. I think my vocal is...
yeah,
I'm okay with my vocal. In my opinion, stress is, if you are able to cope with the stress to certain level, now it will help you for your growth as well. But sometimes a situation comes where you are not able to control your stress and that brings negativity to you. Then at that point of time, I think you should be thinking that, okay, things are going out of my control. Now I think I should be careful on that. But to some extent, it's positive. I think it is positive as well because it helps you to entice for your growth, for encouragement as well. That's my opinion on that.
Thanks, sir. You are so right that we have two types of stress. One is positive impact and is a negative impact. If stress we take as a positive and it helps to outcome the result good. If there is stress is going on negative, then it leads to the burnout. And obviously, so like stress is very important to drive our life. We have to take stress, but stress should be limited. That results should be effectively. So we should not go to burnout. Means stress means to cope is number one phenomenon in stress. How we are coping with that situation. If out of handling that situation, then we will go to the burnout. So lots of burnout result into severe mental illness.
Dr. Arpana, what is the difference between stress and burnout?
Stress is because of the acute condition, at present, whenever there is any, let's say because stress at workplace or any events happening in our life, so that might be acute condition, and this impact, piling of stresses lead to burnout, and the indicators which indicate that people are exhausted or burned out are physical. We have physical and mental health impacts. Physical health impacts that they are easily fatigued or tired, and we usually hear people calling, I'm definitely not willing to wake up in the morning. I don't want to go to office or anywhere, workplace. This does not sound interesting to me at all right now. So these are the factors which indicate that we are burned out, and but sadly we deny it because we have to anyhow go to a workplace or anywhere. And mental health impacts, talking about mental health impacts, it may lead to anxiety. These prolonged effects lead to anxieties, depression, and even patients are suicidal. Many people are suicidal because of it, burnout, and because they try to neglect these alarming signs which have happened to us before, and we deny it, and this eventually leads to any mental health impacts. They are usually irritated, and that impact shows a change in behavior, which leads to any other problems in life.
Other signs which can also help us in identifying burnout
is in every system, like cardiac, GI, every system is involved in burnout. So in cardiorespiratory system, there is more prone for any infections, because stress definitely leads to change in neuroinflammatory markers in our body. So which leads to infection, repeatedly a person will have infection like flus, any other infections in the body. And cardiac, talking about cardiac, repeated stress may lead to MS, myocardial infarction, or which is heart attack, then general term heart attack. So we should look for help, seek for help whenever we have any chest pains or any other features regarding it. And GI disturbance, many people they have constipation or diarrhea because of those burnout problems.
It seems like we usually suffer one or two of these symptoms, and sometimes we tend to diagnose ourselves.
One very important thing.
I just wanted to ask a question. Like, I don't know whether education is, students taking classes or having education is also included in the workout. Like we have heard many times of recent incidents where students have committed suicide. Is it also a sign of a burnout? Or is this something else?
In pattern of students, one thing is very important, that how their parents are coping or how their parents are interacting with their children. Number one, there is, in our context, in our Nepal as well, there is age between the parents. Thinking of parents is one side, and thinking of children or young boys or girls is another side. So in between there is barrier and communication barrier, there is number one case of deteriorating towards stress towards the burnout to those young people. So what they want and how their parents are parenting, more focusedly nowadays from 16 age to 22 to 25. Lots of young generation are abusing drugs. Cannabis is number one, alcohol and hookah. These are the most of them go to clubs. However, the parents do not know that what my children are doing. Suddenly, one day, parents see about their children are taking a cigarette, then they will be themselves they will go from anxiety. That is, they think that my children are doing good at school, but how their children is deviating towards the youngster. Youngsters are so versatile; they know everything now. So we can talk to sexual education as well as occupational. We have to go on because so digital world, they are sourcing many things. Now our patient, young male, female, they come and I am suffering from anxiety. They direct to, we people do not know, but they source to the Google and they see all those anxiety features and they directly diagnose themselves and they come to us. Doctor, I am suffering from that anxiety. How do you treat me? That is the question of new generation nowadays.
Like being a psychiatrist, what do you advise? How can we overcome that kind of a barrier between a parent and a child?
First of all, communication. Always we think that our children are also have to be communicated. So we have to give most of time to the children. Which time we will give? Morning, tea time, lunch time, and dinner time should be always with your children. Most of our parents, they think that they come too late to the house and children already they are taking their food and they go to the bed. And there is communication gap in between. Then that communication gap leads to the misunderstanding between them and leads to the ultimately the drug abuse and burnout to the children.
I would like to hear from Dr. Arpana as well. Besides the same question he asked, whether the stress in the students can be called burnout.
That's a good question, Sarah. As from your experience, you have this question in your mind. Our children from this generation, from your generation to this generation, there is a huge gap, and which these generation children, they usually do not have resilience power. As we all know, they have immediate gratification. They want things at present. If they ask for it, they want it right now. So it is our responsibility to explain it to them that there is no, as we grow up, we cannot get whatever we want immediately. So we should also let them know what is the ground reality of our situation at home, and also the immediate gratification should be delayed. and that is one of the important way to reduce any mental illnesses or any type of illnesses. And also, I would like to tell that there are few students who maybe because of peer pressure. We may have mental illnesses because of peer pressure, bullying, or anything. So that needs to be reduced, and it is a responsibility of everyone in our society, like teachers, any gatekeepers, as we call a gatekeeper training in mental health. Anyone can be a gatekeeper, like children, teachers, parents, and peers, everyone. So that is important, and we need to develop ourselves to reduce these situations like any kind of mental illnesses.
Regarding this reduction, I would like to start with the coping with stress. How do we cope with stress? Especially focusing for the work stress.
Coping is with stress, there is different methods. One more idea, that is also the coping skill. And some go to jogging, morning exercise. Give your time. One thing coping with the stress is give your priority first.
Give priority to yourself. Love yourself.
We lots of give our priority to our job, to our family, but we neglect ourselves. First of all, give your priority yourself. Then is family. Then is job. So that prioritize yourself means how to handle the stress, means how to relax your brain or how to relax your mind. This relaxation of mind is to making yourself peace. We can do peace in different manner. Yeah. Like you can go to yoga, Zumba dance, with the gym, yoga start.
The thing is, we tend to relieve our stress, but that seems temporary. How does it help in long run? All the stress relieving are temporary, but then the stress will come back again.
Obviously, the short run is ultimate result in the long run. First of all, we have to think how to relieve our stress in short run. It may ultimately result in the permanent to the long.
As you mentioned, we have coping skills. Regarding coping skills, there are healthy and unhealthy coping skills. Whatever we do, like sometimes we isolate ourselves from whenever we have stress. That is unhealthy coping skill. As you have mentioned, this is for short term only. Whenever we isolate, this is for short term. For the longer run, we have to go for any walk, exercise. These are for longer run. And we should talk to people, communicate, and prioritize, as Sir has already mentioned. And we say mindfulness, meditation. These are very important, like where we teach patients deep breathing exercise. We'll be teaching you later. And that is very important. These are the healthier coping skills, and these are for the longer run.
And one last question, especially being a female mother, how do you handle the stress and how are you coping with it? Please say the experience.
I don't know how am I coping myself because I believe being a psychiatrist, I was also not left because I myself I suffered from postpartum depression. In this, I have 2 children and
that's
6 months. I'm 6 months lactating right now, and I was myself suffering from postpartum depression in second pregnancy. And what I did was I talked to my family members. I had good support from my family members, and I used to talk to everyone regarding whoever was in that active phase of lactation or postpartum phase. And I used to tell myself, this is only for the short duration. This is not going to last for the longer run. And definitely these our children, they will grow up, and balancing life, work life and home life, it is very difficult. And we should also talk to people who are related to that field. I used to talk to my seniors. I used to talk to him. I used to talk to others, and female themselves, female psychiatrists. So we should talk to others, and we should also tell that letting yourself out is not a crime. I used to go out sometimes. I used to tell my husband to take me out somewhere, and because this is not a crime for us, we should prioritize ourselves and give ourselves some time. And prioritizing is very important in motherhood.
It seems
And
like we have to accept, learn to accept, and let not the stigma run towards us or the society.
whenever a mother goes out without without her children, who is very small, so she's judged, and we should let them judge, let people judge, but not judge ourselves, because this is our life, and if only a mother who is happy can raise a happy child, definitely.
True.
Happy mother
Leads to happy
True.
child.
Towards the final segment of the versus fact that you have come across, also some leading examples that you have seen that you must share. Can you share about those?
Myths and facts about mental health is that myth is that mental health, if they are suffering, it is untreatable. That is very, very untrue. Mental health, if early we go, how much early go, treatment is fast. How much we do late, treatment long time, and how much you chronicity long, duration of treatment with medication also lasts long. Another thing, all the mental illness, they think they are dysfunctional, they cannot do work, they cannot go to job, but that is untrue. They can treat and they can go to job as well as, and they can lead the institution as well as. And one thing that lost of our society, they are faith healer. We would go to Thami Nakri for different treatment of the mental illness, and we not all we hear to the patient and to the you can go, but you also come to if you need help to us. We go to bilateral.
Dr. Arpana, any case example that you can share?
Yes, as Sir has already mentioned about the faith healer, everyone in our family, whenever we suffer from anything, let's say diarrhea, this is very true in all the aspects, not only mental health. First, only the faith healer is a doctor for them, and secondly comes the allopathic medicine. So we have faced many situations in life, experiences, and whenever a person with psychosis, we have seen many patients who is psychotic and they go to faith healers, and after years of treatment from them, then only they visit us. But there are few good faith healers who have humanity left in them, who refer to us, because this is they distinguish what is true mental illness and this is not going to be treated from me. So they refer us, they refer the patients, they tell that you have to visit a doctor, you are not going to be cured from our side. So
indeed, I remember as well, not just for mental health, for any other illnesses, they were practicing the faith healers, and then our government had to resort to treating or educating the faith healers as well, in order to refer the patient to the doctors. So it really improved the health system of the society, and it really helps the government as well. On the final note, we have few minutes left. If we have any questions, then we can take it from the audience.
Just out of curiosity, I would like to know, how do you differentiate a stress level that is has mental illness? When do you begin the medication to the stressful person, or treat a stressful person as mentally ill person?
Express your expression towards a family member. Ultimately, it resolves. If stress go to the distress level, then only you need for help. And that distress level ultimately go to burnout, then you need for expertise. But if it is totally destroyed or functioning to your biorhythm, like sleep, totally you are coping with the stress. However, you are talking with the family member, but you cannot sleep all night. Always running of thoughts, chain of thoughts is always running in your mind while you are. We think that there are people, they are not sleeping more than a month. What is their situation? We have to think that. If we are not able to sleep a single day, the next day what is happening to us? But there is some people, they are So if they are changed in biorhythm, sleep, appetite, and totally destroyed in their behavior, they are not left the job, then they need to have medication as well as counseling.
If you have any questions, then we can also take them towards the end of the session, towards the end of the program. Our expertise will still be here. We have got 1 more minute left, and if any other questions that can be addressed, please share them today.
I want to ask a question, and how you are coping with your stress? In our life we feel stress, but how we are coping with stress?
I also did like the plan of myself and my our family and my kids, so that I don't get lost with what I need to cook to my children and how to get things, and also making the boundaries of your workspace as well, like not overworking. And also I also have like stopwatch and just get stopped like when I'm done with my hours. So that's
Stopwatch is one of the smart ideas. At Toastmasters Monitor, we will also try to share something.
Next one is 2 years old. So whenever I feel stressed, I just sing a song. Just sing song, just sing together. Then I feel like one thing I want to ask that like you have told about meditation, yoga. My in-law, whenever she feels stressed, she just go to plant the flowers, she play with those flowers, and after 1.5 years, she feels and she just come down. Is that also therapy or kind of therapy or something?
Yes, definitely. As we sometimes some people they have a hobby of gardening, so that is also de-stressing for themselves. And having a pet itself is de-stressing. So that is a therapy for her. That is self-medication for her.
And yes, going out with nature itself releases the stress. That is why one of the stress busters is going out.
One last question. My father is a doctor and recently he was diagnosed with anxiety. Okay, and in new hospital, Maswali, he has now he's back to usual, and he has been given some medication, medicines. He needs some counseling or therapies, or it's okay with those medicines also.
The doctor in Maswali must have taught him the deep breathing exercise. So
We have also acted like that.
actually, what we tell is some patients, meditation is not for everyone. Because there are patients whose symptoms get aggravated with meditation itself. So there are, we should individually select a person with a particular type of meditation. So in acute phases, so we do not recommend someone for meditation right away. So maybe he's in the
He has given
stabilizing
some
phase.
medications and he has come back to usual, but he has not said anything like some therapies or counseling or like that.
Maybe that is the reason that he does not need it. But simultaneously, if we go with psychotherapy and medication, pharmacotherapy itself, medications, then that works well for everyone. And therapy itself is just a term. Because whatever the doctor in Basbari must have done it, so he must have recommended it for sessions. Because in one session, also we can talk to the patient the same thing, and we can go for many sessions.
Thank you, Dr. Arpana. Now we are towards the end of the session, and I would like to have some closing remarks from both of the
Just
expertise.
one thing I would like to add. At some point in my life, I was very stressful, and I would like to share how I coped with my stressful situation. I started doing meditation, and in meditation there is a dynamic meditation in Osho. I would like to briefly talk about it because it helped me a lot in my transformation. The dynamic meditation, in one part of the meditation, there is a process called catharsis. If we are familiar with the word, catharsis is the process of compelling ourselves, like it to loosen up.